Bismillahirrahmanirrahim. A model demonstration of the inferior aspect of the human skull. This is the alveolar processes. The incisive fossa, the intermaxillary suture, the palatomaxillary suture, the palatal process of the maxillary bone, this is the horizontal plate of the palatine bone. This region represents the greater palatine foramen, having the lesser palatine foramen inferior to it. And this is the tuberosity of the maxilla behind the molar tooth, the tuberosity of the maxilla. These are the teeth: molars, premolars, canines, and incisors. The zygomatic process. The zygomatic bone. Temporal part of the zygomatic bone. Zygomatic part of the temporal bone. They are forming the zygomatic arch. This region represents the infratemporal fossa, and laterally we have got the temporal fossa. This region represents the the petrous part of the temporal bone. Between the greater wing of the sphenoid and the basilar part of the occipital bone. The petrous part of the temporal bone. This is the posterior nasal aperture. It's the posterior nasal spine. The nasal septum formed by the vomer bone. Inside we've got this greenish perpendicular plate of the palatine bone. The perpendicular plate of the palatine bone. These are the superior nasal conchae, the middle nasal conchae, the vomer, and this is the ala or the wing of the vomer, Between the temporal fossa and the infratemporal fossa, we have got this crest of bone known as the infratemporal crest. Which differentiates between the temporal bone and which differentiates between the temporal fossa and the infratemporal fossa. This is the basisphenoid part of the sphenoid bone, and this is the basi-occiput bone of the occipital bone. Basisphenoid, basi-occiput. Greater wings, these are the greater wings of the sphenoid bones. Basi-occiput, and they form the roof of the nasopharynx. Now we move on. The pterygoid. This region represents the humulus of the pterygoid, medial pterygoid plate. The medial pterygoid plate, the humulus of the medial pterygoid plate, the lateral pterygoid plate. The lateral pterygoid plate, humulus, and this is the pyramid. This region represents the pyramidal process of the palatine bone. Pyramidal process of the palatine bone. We got the medial pterygoid plate, the lateral pterygoid plate, and between them we've got the pterygoid fossa. The pterygoid fossa. And beneath, inferior to the pterygoid fossa, we've got the scaphoid fossa. The scaphoid fossa over here. The foramen lacerum, foramen lacerum. The foramen ovale. Ovale. The foramen ovale. And beneath that we've got the foramen spinosum. The foramen spinosum. There it is, foramen spinosum. Okay? Spinosum, and near to the foramen spinosum, we've got this spinous process of the sphenoid bone. This region represents the spine of the sphenoid bone. Spine of the sphenoid bone. The zygomatic process. Okay. On the zygomatic process, we've got a tubercle known as the articular tubercle. The articular tubercle, which communicates with the articular eminence, and this is the region of the attachment of the articular cartilage. Articular cartilage. This is the glenoid fossa or the mandibular fossa. The styloid process. Styloid process is broken over here.
Let's do it.
This is one day you'll be sitting in front of me during Viva. Okay, this is the mastoid process, a large mastoid process.
Our main feature,
The external auditory meatus, and the mastoid process has got medially a mastoid notch, also known as digastric notch, for the attachment of the digastric muscle. And medial to the digastric notch, we have got the occipital groove for the occipital artery, which is a branch of the external carotid artery.
One day you will ask to present this bone.
This region represents the mastoid foramen. This is the condylar fossa.
The TMG joint.
With the condylar fossa, this is the condylar canal. This is the condylar part of the base of the occiput. The occipital condyle, and it articulates with the first vertebrae to form the atlanto-occipital joint.
Here TMG joint is found.
No, not here. TMG joint is in another place. I will show you. Condylar canal. This is my Kaliwal Siraj. Okay, this is the condylar canal. This is the pharyngeal tubercle for the attachment of the pharyngeal constrictors. This is the inferior nuchal line, superior nuchal line, the external occipital protuberance, and this is the external occipital crest. Foramen magnum.
This is foramen rotundum.
We are coming to it in a moment. Please wait. This is the carotid canal, and this is the jugular foramen. And beneath the occipital condyles, we've got the hypoglossal canal. The hypoglossal canal, jugular foramen, hypoglossal canal, and the carotid
I
canal.
think this should be the foramen rotundum.
This is the foramen lacerum. In this model, foramen rotundum is not easily identifiable. I don't know why. Diksha?
So this is nut
Yes.
of our
Okay. Between the styloid process and the mastoid process, we've got a stylomastoid foramen for the facial nerve common. Okay. Yes, Sayusho, Ramusho.
You are understanding me, or I am teaching myself.
Foramen ovale. Okay. Beneath the foramen ovale, we've got this. Yeah, this is the foramen ovale. And inferior to the foramen ovale, we've got this auditory tube, also known as eustachian tube. The auditory tube. Scaphoid fossa. The posterior nasal aperture, also known as coini. Posterior nasal aperture.
septum.
Foramen lacerum. Yeah, pterygoid tubercle. Okay. The pterygoid tubercle. The medial pterygoid plate has got a pterygoid tubercle. Medial pterygoid plate has got a pterygoid
This, of course, will be broken.
pterygoid tubercle. Yeah, pterygoid tubercle is over here, just near the basilar part of the occipital bone, the clivus, and this region represents the pterygoid tubercle, which is continuous with the pterygoid canal. These are the vaginal processes of the vomer bone. So this was about the inferior view of the skull.
Base of the skull.
Base of the skull, inferior view of the skull, inferior aspect of the skull, whatever you call it. Thank you.